Dr. Bobart, what are the aims and methods of this study?
Oxalate nephropathy is characterized by deposition of calcium oxalate crystals in the kidney and is commonly under-recognized. Common causes of oxalate nephropathy include primary hyperoxaluria, enteric hyperoxaluria, and ingestion of excess oxalate or its precursors. In this study, we aim to report the clinical and pathological characteristics of one of the largest series of 31 patients with native kidney oxalate nephropathy to date, from January 2015 to March 2023 at the Cleveland Clinic. Utilizing the Cleveland Clinic Kidney Biopsy Epidemiology Project, we identified patients with a biopsy-proven oxalate nephropathy and via retrospective chart review described the clinical, laboratory, and pathological findings with a focus on risk factors and outcomes. Dr. Sawaf, what are the key findings of this study?
The three results of interest I wanted to focus on involve secondary causes of oxalate nephropathy, secondary diagnosis on kidney biopsy, and the clinical outcomes. Regarding the secondary findings, 20 out of the 31 patients were determined to have a clear etiology of oxalate nephropathy, of which only one had primary hyperoxaluria. Among other causes, those included enteric hyperoxaluria, with gastric bypass being the most common cause, or high precursor intake with vitamin C being the most common cause. Importantly, there were 10 patients with multiple risk factors of oxalate nephropathy. As far as secondary diagnosis on biopsy, a surprising 27 out of 31 patients had secondary diagnosis in addition to oxalate nephropathy, with ATN being the most common, found in 17 out of 31 patients, followed by diabetic kidney disease in 7 out of 31 patients. The most concerning finding was that the degree of fibrosis of these biopsies was severe or moderate in 38.7% of the patients and 51.6% of the biopsies, respectively. The renal outcomes of patients diagnosed with oxalate nephropathy were quite poor. Of our 31 patients, 26 had data beyond a year, and 21 of those 26 were dialysis dependent by the end of the year, with only 5 who remained dialysis free. Dr. Bobart, what are the limitations of the study?
Given its retrospective nature, we only captured data available in the electronic health record. Therefore, this study has limits on the number of patients receiving genetic testing, oxalate levels, so missing data is a limitation. However, I think it highlights just how much more we need to do for these patients so we can diagnose and manage earlier to avoid these poor outcomes. Dr. Sawaf, how can the results of this study be used to change clinical practice or service provision?
The study not only highlights the poor renal outcomes of patients with oxalate nephropathy, but also shows how common it is to have multiple risk factors associated with this pathology. This can alter our expectations of what we expect when a diagnosis of oxalate nephropathy is made. This study also demonstrates the importance of educating patients with risk factors such as gastric bypass to avoid further risk factors, including a high oxalate or vitamin C intake, and educating clinicians to screen for these risk factors in patients with hyperoxaluria, use food diaries, or check plasma oxalate levels. Dr. Bobart, briefly state anything else you would like readers or listeners to learn in this podcast.
Overall, we enjoyed working together as a team on this article. We hope it will help readers understand the risk factors associated with oxalate nephropathy to help educate patients, clinicians, and overall improve earlier detection and treatment to improve patient outcomes. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.